Understanding the layers and functions of skin anatomy is crucial for tattoo artists. The process of tattooing involves penetrating these layers to deposit pigment, and knowledge of how this affects the skin is essential for ensuring both the beauty of the art and the safety of the client. The skin is divided into three main layers: the epidermis, the dermis, and the hypodermis. Each has distinct functions and plays a specific role in tattooing. Epidermis. The epidermis is the outermost layer that the tattoo needle first penetrates. While pigment is not deposited in this layer due to continual cell turnover, it's the first to show signs of healing post-tattooing. The body's response to the tattoo needle includes inflammation and scab formation, which are critical parts of the healing process. Proper aftercare ensures the epidermis heals quickly and cleanly without affecting the tattoo pigment beneath. Dermis. The pigment is deposited in the dermis, just below the papillary layer. This layer's stability and slower cell turnover make it ideal for holding tattoo pigment, ensuring the tattoo's longevity and clarity. While the introduction of pigment into the dermis doesn't significantly hinder the skin's ability to perform its functions, the healing process may temporarily affect dermal functions. Proper aftercare and infection control are key. Hypodermis. Tattoo needles should never penetrate into the hypodermis, where the fat layer can cause pigment to spread or migrate, leading to a less defined tattoo and a less desirable outcome. It also increases the risk of pain, scarring, and excessive bleeding. The thickness of each of these layers will vary based on age, ethnicity, and area on the body. Adjustments for proper depth must be made continually during the tattoo process. Finding the sweet spot is called dialing in, and this will be different for each person. It's essential to spend a few seconds dialing in with each individual client. We will discuss this further in the needle theory section.